To revitalize family planning, we've developed a strategy at AID, and we've picked specific countries that we want to work in, and we've got to get back, in many respects, to the bread and butter of family planning, getting it back into programs, getting policy changes, getting governments to be supportive of family planning, getting best practices into those countries, ensuring a wide range of services both clinic and at the community level, ensuring a supply of contraceptives, lots of training, capacity building, the standard things that you need to do to develop a successful family planning program, and just putting extra money into those programs and trying to get all partners to work together in those programs. In terms of lessons learned from the past, one of our biggest areas of work is trying to make sure that what we have learned works in one place that we think is generalizable to other places, we import or export to other countries. Community-based services, not just clinic-based services. Task shifting. You don't need physicians to provide all methods. That you can do a lot of task shifting and have lower level health workers, skilled and not so skilled, be trained to provide a range of services and do counseling and put together the whole package of family planning services that will expand the use of methods, because if physicians had to do everything in countries that don't have many physicians, you would be doing nothing. So we've learned a lot of lessons in family planning. And frequently you need to do demonstration projects, because many countries say, just because it worked there, it may not work here, show us that it works here. And it's a shame when you need to do as many demonstration projects to show that women in one country will behave similarly to women in other countries. And there's a lot of work, the policy work is desperately needed to get adoptive and supportive policies at the government level, at the family planning manager level. One of our technical priorities now includes community-based services. And in that context, one of the most important things we're doing is showing that Depo-Provera can be provided at the community level. You can train community health workers to safely give a Depo-Provera injection, and they do marvelously. We've done some research around this, and we're also doing some demonstration projects. But in some countries, there's a policy that says only nurses or doctors can give intramuscular injections. So we need a policy project, and we need policy work to advocate and to demonstrate that in that most skilled and unskilled health workers can be taught to safely do an intramuscular injection. And we've got example after example of countries where that's happened, and we're trying to expand that widely, because that's one of the only ways women in a community will have access to a very popular method. And sometimes it requires policy change to get non-physicians and nurses, non-nurses, to be permitted to give an intramuscular injection.